Well, welcome back for rejoining us. I am so pleased after that morning session that we get to now hear from Megan Schilt. She is a therapist and works with people on issues of trauma and has also experienced some things in her recent life that have caused a lot of work that she needs to be doing with herself. And she's bringing a lot of new growth and knowledge with her as she goes into these next parts of her life. I'm so excited. She works at Avenues Counseling. She actually runs that business in Monroe, Wisconsin, and she has a great staff. She's doing some amazing other things with education in the community and reaching workplaces and other people in the community just to have these conversations. So I'm turning it over now to you, Megan. I'm so grateful that you're willing to share what you're about to share with us today.
Thank you, Bridget, so much. Okay, I have to name that I'm very nervous today. So I'm just going to take a second for myself. This is I'm already emotional. I don't know how I'm going to do this. It's a really meaningful place to tell my story because it's so close to home for me, which feels very scary and very healing at the same time. So I will start out right away by just naming that I get a little bit emotional when I share my story, especially with people who I value as much as I've kind of looked through some of the participants, and I see a number of colleagues. I see a number of people who work in schools and law enforcement and health and human services, and I'm just really grateful for all of you and all that you do. And I have a lot of respect for all of you. And so I'm really, really hoping that everyone can get something out of this today. My story, so I'm sharing a story with all of you that is part of my life, but it's also part of my family's life. And so I want to be really respectful of my family members, the people that I talk about on here. And I'm going to go into that a little bit. I have some kind of framing or housekeeping that I'll go over in just a minute. That I will kind of talk about how I'm going to set that up and how I'm going to tell this story in a way that I hope can leave all of you with something personally and professionally. But first, I just have to, and this is where I got a little choked up at the beginning. I just have a lot of gratitude, a lot of gratitude for Bridget and Julie and her team, Missy, and the planning committee and the team of people who are executing this gave me the space to talk to them about my story and invited me to be here. A lot of gratitude for all of you for holding space for me and allowing me to be here, and allowing me to use my voice in a powerful way, because that has been my trauma, is that I have felt very powerless to protect my children at times, and I've felt powerless to take care of myself at times as well. And as a therapist who works with people who've been through trauma, I can go into a place where I start to question how effective I am. How can I be an effective therapist when I'm falling apart myself, right? So I do a lot of work around that stuff. I know I'm a good therapist, and I know I'm good with trauma, and I know that my story has helped me to be a better therapist, a better mom, a better person, a better wife, a better friend, a better colleague, a messy person, and a person in all of those roles, but a better person. And I hope I can share some of that with you today. So thank you so much, Bridget, and for the team, the planning team, for the Behavioral Health Summit, for the Behavioral Health Partnership. thank you to all of you for making this happen and for allowing me to be here today and holding space for me. So I'm here with you to share a story. And one of my favorite quotes is from Maya Angelou, that one of the greatest burdens that we can carry is an untold story inside of us, right? So I choose to be here, as painful as it feels sometimes and as anxious as I get about it. I choose to use my voice to share my story because I know it's the right thing to do. And I know that it has the power to change lives. So I promise this is going to get easier as I go along, but I appreciate you letting me be like totally vulnerable here. So the story I'm going to share with you today is a story of, it's my story, but it's my daughter's story, and it's my family's story. And it's a messy story, and it's a story I'm still in the middle of, which I'll share a little bit with you about as well. And before we dive into it, I want to offer up some of these housekeeping things, or I like to call it a frame, really. I like to frame things up a little bit. So I realize there's a little bit of a delay here. I did just change my slide, I think. This is where I'm going to, but first we're gonna frame things up. It's coming, setting the frame. And so I am telling my story from my perspective. And so I think it's really important for me to let you know, this is my inner experience of events, of interactions with people and with systems. And some of those systems and people are going to be, are going to connect with you somehow. I'm going to talk about the mental health system, health and human services, the legal system, the medical system especially. And one of the things that I have gained through my traumatic growth is the ability to hold on to a number of things and feelings all at one time. And that includes gratitude and disappointment for some of these systems, because what I understand is that systems are made of people, and of human beings. And as humans, we are imperfect, right? And our systems are imperfect. But we don't create change without addressing the imperfections. And I am going to, excuse me, do my very best to do that in the most responsible and respectful way. I am not here. I'm going to actually advance a little bit because these slides these pieces are going to be coming up. I'm not here to trash talk anybody. So I'm not here to talk poorly about any person or system. For as many traumatic interactions and really, really difficult situations I have found myself in with people and systems, I've also had really beautiful and healing experiences with people and systems. And so I am going to talk about it all. And my goal is not to offend anyone. And I am human and imperfect myself. And so please let me, if I do offend anyone, I am more than open to respectful feedback around that, and encourage it, please, because I do want to be mindful of everyone, and everyone's perspective is important to me. I'm sharing mine, but that doesn't mean I'm not open to hearing others. So in advancing this a little bit further, sorry, I know I crinkled my paper. I have to follow my notes on this part. The rest of it, I can tell my story without my notes, but in this, I want to make sure that I hit all the points. In speaking of perspective, I keep looking over here because I have two screens, by the way. In speaking on perspective, my perspective is I'm a human and I'm a clinician, but first I'm a human. And I fight back and forth with myself every time I do a presentation on this. When I tend to self-protect, when I feel very vulnerable and unsafe at times, the sense of, oh, this stuff is creeping up on me and I'm feeling anxious. When that happens, I tend to go into my clinician self and try to give you this presentation from a very clinical standpoint. I'm avoiding my human experience a lot of times when I do that. And so I'm trying to be very intentional about showing up as a human first. That's one of the huge lessons I've learned throughout my traumatic growth experience. And it's something that I'm just really, really trying to stick to. And so you are going to hear me move in and out of human experience and clinical understanding. I'm going to try to stick as tightly to that human experience as I can, even though there are a number of clinicians and people who could certainly understand all of this from a clinical aspect. So I want to give myself just a quick privilege check. And so the reason that I think this is important right now for me here in the space telling my story is that I've been doing a lot of work around just around understanding my privilege and the role it has played in my life, how it shows up in this story that I'm going to be talking about, and in being respectful to people and systems. I don't want to minimize my own experience or dismiss any of the pain that myself or my family or the people close to me have experienced around my story. But I do want to just acknowledge, I feel that I can do that more openly if I'm able to acknowledge the fact that my privilege has allowed me health insurance through my husband's job. It's allowed me to have really good medical care throughout my life. It's allowed me to have an education, the ability to heal in a way and understand the things that have happened to me in a unique way, in a way that's helped me to heal and be here today. My privilege plays a big role in me being here and being able to share my story with you. And so it's just important for me to own that and to say that. And my hope for you is that, as I said, that you will all be able to get something from today. Let me pull that up here. I know there's a little delay. There it is. My hope for you is, that you have, we all are experiencing some level of adversity at this point in time, right? We've all had scary, outside of this pandemic even, we've all had scary and confusing things happen to us or someone we love. And I hope that regardless of how similar or different your story is from mine, or your loved one's story is from mine, that you feel some sense of connection here to your own vulnerable human experiences as I share my vulnerable human experiences. It's a sense of connection that I hope that I can make. I hope that you feel some sense of hope for our collective future. And I also hope that you can gain something that you didn't have before today that allows you to help or support yourself as well as others. I hope that you have a new understanding of how trauma impacts systems of all sizes. And I do have to move now into a content warning. So I want to just give everyone a heads up about some of the things that I will be touching on and talking about. I do use photos in my slides. My slides are typically just a visual aid in helping me tell my story so that you can really see and understand my life and the people in it as I'm telling the story. And so I will show slides that will have some sensitive content, and I will always give you a warning before I do that. I will be talking about and showing picking. I started to just kind of list the number of different topics I might be talking about. And so I want people to be aware of this so that you can practice whatever kind of self-care is right for you during this talk and during my sharing of my story. So I talk about medical trauma. I talk about pregnancy and birth trauma, depression, anxiety, PTSD, suicidal thoughts, abuse of an infant, legal system, parenting a child with higher needs, relationship problems that can happen during trauma. I talk about the system and how everyone was kind of impacted in our situation. So what I'm hoping, I will give everyone kind of a heads up when I'm going to stop sharing and retry this here. I will try, I share my story through pictures, and my slides are less information and more visual, for kind of going along with my story. And so I'm going to be intentional about letting you know when there's going to be a slide that might have some sensitive content. And I'm just inviting you to do whatever feels like self-care for you in that moment. If you need to take a break, if you would like to, even come back, check back with the talk a little later, or leave altogether, whatever you need to do. I'm just trusting that everyone will practice their own self-care in this. But I'm wanting to at least let everyone know that there is some triggering content, likely for everyone, because we've all been through hard stuff, right? And again, the hope is that this can connect to people. Please reach out to me at any point. Okay, good. I'm so glad. Thank you guys for letting me know you can see this. So my bullet points are all here that I started talking about. And then the last couple of points are basically about reaching out. Please email me if you have questions for me, if you are looking for certain resources, if you just want to share your story or your thoughts or your feedback about today, please feel free to reach out by email, and please give me grace in the amount of time it takes me to respond to that. I really value people who reach out in connection after they hear my story. And sometimes it takes me a little time to get back. One, just because I have a lot going on, a lot of things that I hold and a lot of people I hold in my life. But also because sometimes the content of this can be overwhelming for me, and I need to take a little space from it for my own self-care at times. So with that, I want to introduce you all to myself and my people and my world. This slide that you're going to be seeing here is my life in a nutshell, personal and professional, everything in between. So I have 4 children. You're going to be hearing and getting to know, you're going to be hearing about them, getting to know them. My husband, Rob, and I are both from Monroe, born and raised, and now we're raising our children here amongst our village. So these people in these pictures are our village. They're family, friends who feel like family, biological, chosen, everything in between. You also are going to see some of my professional background on the right-hand side, where a team at Avenues Counseling that I work with, a number of people who've been a huge part of my trauma process and my growth process, as well as the formation, Avenues Counseling started at the same time my trauma started, the same month, actually. So that has been a big part of my story. So I just wanted to kind of give you this visual to share with you my world and my people as I dive into this story with you. So what I think is important leading up to this slide is to let you know, this picture was taken October 1st of 2017. I was about 21 weeks pregnant. Excuse me. Lane, my oldest, he was 6.5, and Ander was 4.5, and Reese, she was 21 months at the time. We were at a pumpkin patch farm with our family. It was kind of an annual tradition that we do, and so this picture was taken there. And this was about 3 weeks, a little less than 3 weeks, prior to things really changing for us. There's kind of before October of 2017 and after for me at this point. And so we were blissfully unaware at this point in this picture of how life would change. And so this picture has a lot of meaning for me when I look back at it. But I want you to know, going into this background, in terms of my background and just where I had been leading up to this, I had what I've come to understand about myself. I've grown up to have somewhat of a codependent nature. and being a people pleaser, and kind of finding my own self-worth in my ability to do for others. And often that is my superpower, but it's also, everything in moderation. And when there's not balance to my passion for helping, that can turn into kind of an unhealthy, toxic personality kind of trait that I can take on when I'm in stress and trauma, right? And think about the stress we've been under, right? So it's in terms of my capacity to make healthy choices for myself, that typically is compromised when I'm under stress, and I tend to go to my default mode, right? So I like to let people know that leading up to this, I was becoming kind of aware of these things, and I was working on self-growth and trying to heal from some of this people-pleasing stuff, professionally and personally. And so that's where I was at, trying to set some boundaries, October 1st of 2017. And so what I want to say about what happened, where this kind of starts. October 19th of 2017, I was 24 weeks pregnant. I turned 24 weeks pregnant that day. And I finished up with a session at work. I'm a therapist at Avenues. Finished up with an afternoon session, and noticed that it seemed like my water had broken, which was a very big surprise. I ended up calling the hospital I was doctoring in, Madison, called my husband, and he took me up there. On the way to Madison, my water ruptured fully, and I started contracting. We stopped at an outpatient clinic on the way and asked for help. They called an ambulance, and I was taken the rest of the way up to Madison. I was taken to the hospital, and I spent a weekend in labor and delivery, where the medical staff were able to stop the labor at that point. So that was a very overwhelming experience for us at that point in time, because I have to let you know that with my other three, I had uncomplicated pregnancies. And there's another, in terms of privilege, I was very privileged to have healthy full-term pregnancies, enjoyable for the most part, outside of, the regular aches and pains. So this turned very quickly, and it was very unexpected. And neither my husband or I had any idea of how to handle this or what to do with this. What happened is that we were overwhelmed with medical staff from the NICU, from the antepartum department, from the high-risk pregnancy teams, coming in and giving us statistics about how likely it was that our baby would survive. At that point in time, we knew we were having a girl. She had just turned 24 weeks. We were trying to choose between three names. We ended up with Lennon, obviously. But at that point, that's what we knew. We were having a girl. She was due in February 8th. And here we were in a hospital on the verge of her coming 4 months early, which was frightening. It was terrifying. What we also then were faced with was separation. So isolation. I was in the hospital by myself for 2 months, waiting for her to come. And every day I lived in fear, not really knowing, would I get an infection and they would have to have an emergency C-section and take her right away. And she's only 24, 25, 26 weeks. Statistically speaking, they told me that my chances of that I would either contract an infection, or that I would go into labor and they wouldn't be able to stop, and she would come. And that, statistically speaking, happened within hours to days, up to 21 days. Statistically speaking, I shattered those statistics. Lennon and I both, we stayed in the hospital for 2 months together, which was wonderful. I got her to 31 weeks. It was also torture at the same time, because I was isolated. I was alone. I was scared. I was disconnected. I was lonely. I eventually ended up feeling pretty hopeless. I felt very small, and like I had very little control over anything in my life. My sense of safety was gone, was really gone. So typically when we talk about trauma, right, we talk about a sense of safety, our physical well-being, but then also our sense of connection to others, because we need that to survive. We are hardwired for connection. So I felt that my experience of that was, I was in this position where I didn't feel that I had much a sense of safety or control in any way, shape, or form in my life. And it involved my children, which I think as parents, if there are parents out there, I think we can understand that some of our deepest fears are not being able to protect our children. I had some unhelpful beliefs at that point, that not only was I unable to protect my children, but I was the source of their pain and the harm to them, that it was my fault. So I did a lot of kind of internalizing of the things that happened. And so that's what brought on a lot of depression for me too, I think, in that moment when I was in the hospital, but also after. So I want to share those things with you leading up to moving into these slides here. So October 19th through December 12th, I was in the hospital. And if you think about, I think we can really draw some parallels between the story here and COVID, when we have, where we talk about all the things we've missed out on in the last year and the feelings, just the feelings of grief and loss and confusion and helplessness and uncertainty and all these things, right? I felt all of these when I was in the hospital as well, maybe in a little different way. But my first niece was born while she was born exactly a week after I had been admitted to the hospital, but she was born at the hospital next door. So I was able to see her and meet her before she went home. Halloween, my little cuties there in their little costumes came up and visited me in the hospital. Thanksgiving, my son turned 7 while I was in the hospital. Holiday preparations, I was always a big part. I love wrapping presents and decorating. My husband and my family brought some gifts up and wrapping paper for me to be able to wrap gifts in my room, which was lovely. I missed out on a lot of life. And that's a picture of, I would walk up to I think it was like 12th floor or something. And that was the view. I would just kind of sit and look, and I would kind of sit with myself and just let myself feel whatever it was I felt. A lot of it was kind of dark and unpleasant, but it was what I was going through. December 12th, Lennon was born. So here's some pictures. I'm sorry, you guys, I didn't give you a big enough heads up. So here's some pictures that you might want to practice some self-care for. Lennon was born at 31 weeks, and that meant I got to hold my baby when she was born, which was a huge thing to me because prior to being born it was either 29 or 30 weeks, I wouldn't have been able to hold her. I got to hold her for just a minute or two, and then the NICU team had to take her because in terms of breathing, that was her biggest thing, was her lungs were, she has chronic lung disease. And so that was a concern, but I'm just wanting to give you a little visual understanding of what this hospital and NICU stay was like. So the next few slides are going to be NICU and hospital related. And you're going to see Lennon and myself in the hospital, my other children as well. So I just want to let you know, visiting. So we had some introductions. Our family got to meet this little miracle. She was an amazing fighter. I've never seen, still to this day, any spirit like my daughter's. Anybody who knows her knows that about her. She's a force to be reckoned with. One of the things I love the most about her. Okay, so our NICU stay of my life looked like this. I was driving every morning. I have never felt more torn in two, I can tell you that. I had children at home who needed me, and I had a baby in the hospital who needed me. And I didn't feel that I could be anywhere in the world and feel whole at that point in time. It was really hard. I couldn't hold my baby when I wanted to. So you see my little glowworm there. So Lennon had jaundice, which is pretty common for preemies as well. And so I didn't get to snuggle. There was a lot of grief and loss around the experience of what this was like with her. And as a parent, I think a lot of people can understand how hard that might be. So the NICU and home, these are some pictures of what was going on at home and what was going on in the hospital. You can see my little germ picker, nose pickers up there in the corner, which hopefully is not triggering anybody around COVID. I don't mean to make light of it, but we have to have a little humor once in a while. But yeah, they are little germ bots there. Christmas, here's some pictures of what life was like around Christmas time for us. My son and are there at home. Oh, I just tried to advance my slide and it would not. Okay, it's just processing here. I would pump for 3 hours at night. I had a huge freezer chest full of breast milk for her. I felt that that's all I could really do to protect her and help her. So I did focus a lot on that. That was one thing I felt like I had the ability to do, was to provide her with breast milk that could be really beneficial and helpful. We are growing and thriving, but I was still very much in survival mode at this time, watching my daughter like a hawk. There are alarms in the NICU. There's sensory overload in the NICU that still, can sometimes creep up on me today. It's really an intense experience, I'll tell you that. Every time an alarm goes off, you're holding your breath, hoping that it's, either if it is your baby, that somebody's going to respond as quick as they can. Lennon had a lot of alarms go off with breathing, and so that was a hard thing for me to feel safe around, was walking away from her and not feeling like I had to have a monitor on her or watching over her. So we said peace out to the NICU. On January 17th, we were there for a total of 5 weeks. Lennon was able to leave about 3 weeks before her due date. So this was our peace out NICU tribute. And then going home, though, many people, let me just tell you, we think like, oh, yay, you got to go home. No. At home, there are no monitors and there are no medical staff, and there's no intervention if something goes wrong. But there's still a deep fear in me that my daughter will die. Whether that is rational or irrational at that point in time, it was 24/7 what I thought about. And that is what trauma is, right? Loving Lennon at home. Lennon came home the day before Reese's second birthday. It was awesome. It was amazing that we were so grateful to be able to do that. I had a whole new routine that I had to keep up with. And so you see a picture here of like my last pump, and the last time I mixed, I had to fortify breast milk to help her grow. It was a whole process. It was overwhelming. My brain, if many of you know about trauma brain, I was very much in a survival state, lacking safety. I've mentioned those things many times, but what that means is I didn't have the part of my brain online that could multitask and that could manage all these things. I was really overwhelmed and in survival mode, and somehow got through it. But what happened was, a week after actually 9 days after we were home, Lennon got RSV and went to respiratory distress, needed to be admitted to the PICU. And so once again, and it was life-threatening for her, for sure. We were there for 10 days. It was hard. It was scary stuff. RSV is, many of you probably already know, it's just a common cold to us, but to babies, it can be fatal, and to an infant with chronic lung disease who hadn't even met her due date yet. It's very scary. So once again, another trauma, just kind of compounding on top of everything else. We finally got home 2 days before her due date, and got to stay home at that point in time, thank goodness. So, but still overwhelmed and still trying to survive, right? And I'm sorry I'm going through this fast because I want to make sure that I can get to the growth part of this as well. I'm trying to incorporate it as I talk. So, trauma trigger right here, I'm sorry. I've got a picture here I really want to share with you guys. We found out, I think about 10 days after we got home, that Lennon had been abused by a nurse in the NICU when she was about 2.5 weeks old. And so you can see a picture here. She has a bruise on her face, or she has a few bruises. She has 3 bruises. She was 2.5 weeks old, and she was, I want to say she was under 4 pounds at that time. And I came in that morning, as I usually did, to take care of her, and I saw the bruising, and I asked a nurse about it, and I was just told, oh, I didn't notice that. We'll keep an eye on it. And nothing was brought up again. And I was really small and really feeling weak and overwhelmed and in a fog at that time. My gut told me something wasn't right, but I also didn't feel like I could question people who were taking care of my daughter and saving her life. So I took pictures. This is one of the pictures I took, and I took some videos. And on February 16th, when I had received word from a friend, but also from the news, that Meredith, or that there was, I should say, a nurse being investigated at the hospital for abuse of kids in the NICU, and it was only a month after we were discharged. I somehow found my voice and advocated hard for her. And I showed pictures, and they examined her and they looked in her charts and they confirmed that she was physically abused and harmed by a NICU nurse. And at that point in time, then February of 2017, 2018, is when an investigation opened, and we spent the next 2 years up until February 2020 working with the Dane County DA's office, medical professionals who specialize in pediatric abuse, and a number of other people who supported us and helped us through that process. Also very traumatizing. We've been living in trauma for a few years now. So that was about a year ago, a little over a year ago, we were able to have the sentencing hearing on February 20th. And this was a part that I was able to read in my impact statement that I think represents the depths of my trauma. And so I'm just going to read this to you if you're okay. There's a picture of this hallway that I walked down every night when I left the hospital, and I cried hard. There were, I walked down this hospital hallway and I'd see moms taking babies home, and I'd see all sorts of things that looked like normal life that I didn't know anymore. And so that hallway represents a lot for me. And then this excerpt from my impact statement kind of describes this for me. So I take the elevator down and I walk through the long hallway that's lined up with glass display cases, and I cry, some nights hysterically, as I feel the guilt of leaving my baby and the guilt of not being there for my other children, tearing me in two. So I remember reciting the NICU nurse's reassuring words to ground myself and keep myself moving towards that parking ramp. Your other kids need you too, and this is the safest place to leave your baby. I trusted the system and I trusted the people in the system, and we ended up going through things that no one should have to go through, right? And Lennon especially, not having a voice, not having the ability to tell somebody what happened to her. I found some strength to do that. I found some strength to advocate for her and to use my voice in a way. And that's why I say in the beginning, I hold it all. I have deep appreciation for the medical professionals who saved her life, who helped me, who helped her, who helped our whole family. I also have distrust and disappointment in that system and in people within the system, because it wasn't just the nurse who harmed her, but it was the other staff who didn't listen when I tried to bring it up. And it was the other staff who saw these bruises on Lennon, but didn't note anything in her medical charts about this. So this is something this is one of those things where I don't want to trash talk a system, but I do want to just let you know how it's impacted us, and that I think that there are things that we can learn from this and that we can take into the system, the NICU systems, the hospital systems, the medical system as a whole, and we can educate and we can share stories and use voices to do that, and we can help make changes in those systems so that it is maybe more trauma sensitive or just more patient centered. So in 2020, these were all my kids. We are all okay. However, we've fallen through the cracks in a few places in the system. And I want to share with you, because I'm noticing that we only have a few minutes, and I know I apologize, my fall off. So here I'm kind of letting you know about my traumatic stress timeline. Here's where I add some of my clinical understanding to help myself understand some of this too, and help myself just really help myself kind of hold space for what I've been through. I don't always give it the attention or the energy that it deserves. I don't always give it the credit or the weight that it deserves. What I didn't tell you guys about is 10 months prior to me going into the hospital, my 3 kids at the time and one of our 3 dogs, rolled our van off of a retaining wall in the winter. It got stuck in the country, and the van smelled like burning, like something was burning. And it was an incredibly scary situation for all of us. All 3 of my kids and myself and my husband. He wasn't there, but obviously he was terrified when he found out what happened. But so that happened, and that was like, it was an event that started planting some seeds into my head. In that moment, I felt really helpless. you're going to see the sticky notes up above, and those are going to, so on my trauma timeline here, I'm pointing it out as I'm talking. I talk with my hands a lot, in case you haven't noticed that. But on this timeline, you see dates and events that happened on those dates. Then you're going to see these sticky notes up above. Those are the sticky notes up above are thoughts. The timeline, like I said, those are dates and events, but then beneath the dates and events, you're going to see feelings that I had. So I identified feelings for myself. That's what I want you to know about this before I talk about the content of it, is just a layout of it. So this is my kind of traumatic stress timeline that relates to kind of a helplessness or powerlessness over ability to protect my children, and to take care of them, but also then kind of morphing into even I'm the source of the pain, right? So not only can I not protect them, but now I'm the source of their pain. And these are some deep and very difficult beliefs to carry around with you as a parent. I imagine most of you can think about what that might feel like. So the beliefs I started to take on: I'm helpless to protect my kids from danger. I can't trust my own judgment in keeping my kids safe. I'm a bad mom. I have no control over my body or my situation. I'm helpless to protect my baby from danger. I can't trust my body or myself. We're not going to be okay. None of us are safe. This is my fault. This is never going to end. I must have done something to deserve all of this. I'm a bad person. Don't think I can do this. This is too overwhelming. I can't handle it. I can't keep my kids safe. The world is not safe. I can't trust my own judgment. I can't trust myself. I can't do this. I'm a failure. I give up. Really helpless thinking, helpless and hopeless, right? So some of the feelings, but then also some of the PTSD symptoms I was experiencing: hypervigilance, memories, nightmares, sleep problems, and some of these things, and none of this is fully gone. Some of this comes and goes. I'm still in the middle of healing on a lot of this because I have not really been able to there's been no ending to this yet, right? It's kind of messy like COVID. There's a lot of ongoing and compounding factors that just kind of make this feel like I don't know when the ending, I don't know that there is an ending. So that's where this starts to get a little bit deeper into the PTSD part of it, right? It stuck with me for a while here. But then I want to talk about what is traumatic growth. And I really love this quote from Richard Tedeschi, who's one of the researchers who started digging into traumatic growth a while back. And early 90s, I believe it was, traumatic. And I've talked to you about lack of sense of control and a lack of sense of safety. Our perception, I'm sure many of you know that trauma is based on perception of the events, right? Like, we can all be in a room experiencing the exact same event, but we are all going to walk away from that with a very different experience of what happened. And some of us might feel like our safety was threatened, and some of us might not. And some of us may have symptoms of PTSD show up later on, and some may not. And so it's a really unique and individualized process. I want to respect that, and I also want to share kind of my own process around that with you, so that you can see what that looks like in a real life situation. So when we've gone through something traumatic, we have some psychological distress, lack of safety, lack of sense of control. There's a lot of uncertainty, right? And it rocks us to our core, and it makes us question everything we've really come to know about life, right? So this is the messiest process I've ever been in my life. And what I can say is that embracing the mess is the one thing that has saved me and allowed me to continue to grow through all this, instead of collapsing, because it is the biggest hot mess I've ever experienced in my life. it's a process where I continue to feel like I'm making gains, and then I feel like I'm moving backwards again, and then I feel like I'm making gains, and then I'm moving backwards. And so I don't want to glamorize traumatic growth. It is a messy experience, out of grace and compassion for self and others, and for others to show us grace and compassion. And that's where I have gifts of my growth that I will share with you. A lot of those gifts of growth are people who have stuck by my side in my messiest moments, and I have the deepest gratitude for them. They have shown me, they've actually been a vehicle for my growth. The relationships and the connection have driven the growth in a way I've never understood until now, which is a really beautiful thing. So this next slide here is finding a sense of personal growth. So when we go through difficult things, whether this is the pandemic or other events in your life that have just been triggered and further complicated by COVID or whatever it is, how do we find a sense of personal growth? We first have to ask ourselves the question, not how will we recover from this? How will we be changed by this? We will be changed. We don't have a choice in that. How will we be changed? Will we crumble? Will we be destroyed? Will we conquer? Will we be stronger? Less comfortable, but stronger. And so we have to take ownership and understand our role in this growth process. It doesn't just happen. We have to make a choice to grow through the really difficult things that we go through and don't have a choice in. That's been an empowering part for me in all of this trauma, is taking my power back by saying, this is going to have some kind of meaning and some kind of purpose in my life, and not just in my life, but in the life of other people. And that's why I'm here in front of you, even though it feels really hard, because I believe deeply in every part of me that this is how change happens. People have to be brave enough to use their voices to share their stories. Oh, my traumatic growth is right here. So those sticky notes you saw transformed for me into some of these beliefs here. My body responded to an unpredictable anomaly in the most protective way possible, allowing a miracle to occur that kept my baby safe in a highly threatening environment. That's a belief that I was able to, a more helpful belief and a more accurate belief I was able to take on after having that belief that I couldn't trust myself or my body because it was causing all of this in the first place. Being a good mom doesn't require perfection. It requires love and presence, and I'm capable of those things. And we are all safe now, and we all have the internal and external resources that we need to handle the adversities that will inevitably continue to face, that we will face throughout our lives. And my family, when I say we, I'm talking about my family. So this is kind of how I transformed those hopeless, helpless thoughts. Is I found some truth, and I found some hope. And I did, this took a very long time, by the way. This all started, my traumatic growth process really came to full force February 20th of 2020, when I spoke up and told my story, who was very, very empathetic and understanding and compassionate. And it was heard by nurses who were in the NICU, who I had felt disappointed and somewhat betrayed by at the time, and have since been able to heal with, and actually come together with a couple of them to create a nonprofit for supporting families in our community, but also in the NICUs in the Madison area, which has been a huge gift of growth and a huge piece of that connection. That these were people that I felt that I could never talk to again. And when I saw them sitting in the courtroom, I kind of thought to myself, like, holy, they're here. Like, these nurses from the NICU showed up for us. I hadn't talked to them since everything had happened. And other parents in the NICU, because I felt that they couldn't really understand how I had felt betrayed. And a lot of them had been, oh, it's not the nurse's fault. It's not the nurse's fault. And that's right. It's not. However, it felt dismissive to me, just in that I had felt let down by that system. So just being able to see these nurses hold space for us as parents sitting in the sentencing hearing on February 20th. When we read there were, I think, 3 or 4 of us parents who read our impact statements, those nurses were holding space for themselves and for us at that same time. They were crying, they were distressed, they were falling apart. And I could see how much pain that they were carrying around all this as well. And that allowed me, when I opened myself up to seeing and feeling the pain they were in, that allowed me to create a connection with them that I didn't think I was going to be able to. And now we're going to be able to impact, we're going to be able to make a lot of impact together after something so horrible like this happened. And there were so many hard feelings. And again, that is traumatic growth. And that is common humanity and connection that Bridget was talking about earlier today as well. And as well in the communities. I'm going to move on to this next slide here. Ooh. I think we just need my biggest takeaways. So this is kind of a reflection just on some of my takeaways that I'd like to share with you on my traumatic growth and We Are Coming. Okay, so I had just gotten done talking about human over expert. I think that you guys might have heard most of that, but I'm always showing up as a human over an expert first. And what I can tell you about my takeaway from that is the detectives. So when we had to work with this abuse situation with my daughter, Lennon, the detectives, the doctors, the lawyers who approached us and me with just a human connection instead of talking to me like their professional roles. So when the detective introduced himself to me and told me about his family first, about the fact that he had 3 kids and that he can't imagine going through something like this with them. Okay, hopefully you guys have been able to follow that. When he approached me like that, when the DA's office held space for me, for myself and other parents, and allowed us to sit in a room and talk for as long as we needed to before and after all of the court, the hearings and the appointments and all of these, when the doctor just sat with me and just sat next to me and asked me what I needed, they showed up as human beings before professionals and before experts. And that meant everything to me, because at that time I felt so disconnected and so different from everybody, because I couldn't really believe all the things that were happening. And I was like, who does this even happen to? And what's going on? How they connected to me brought me back to my human self and my connected human self. And that was I needed every ounce of that I could get in that process. And so for all of you who are out there helping other people like this, which I think most of you are helpers and healers, please keep that in mind. If you don't take anything else away today, please take that away first. We have connection over protection. I tend to be a person who likes to protect myself over being vulnerable in relationships. And so I have really come to understand the importance and the power of that. being with people over doing for them. So being with somebody versus like with my kids, when I am in my kind of triggered trauma mode, I will do things for them to be a good mom instead of being with them and being present to be a good mom. And so I have learned the importance of being with people instead of doing things for them and how big of an impact that can make. Trust over control. When we are spiraling out of control and feeling like everything is kind of being taken out from underneath us, we grasp for a sense of control wherever we can find it. And that can be further traumatizing, and it can hurt our relationships. And that did happen for me, which just takes us into further trauma is when, part of my growth, part of the messy part of the growth, but gifts of the growth, maybe a hidden gift, is that relationships change. So I lost a lot of relationships and that felt awful at times. But I have held on to and gained the relationships that have been the most meaningful, connected, and important in my life. There's been a lot of clearing, a lot of space that's been made for those healthier relationships and people in my life. So gifts. Here, I am just going to kind of list out and let you guys relate to these however you might in your own life, as long as it's just kind of processing and working here. Creativity and innovation used to help myself, family, and others. So I've tapped into my creativity and innovation in a way I've never been able to in my entire life. And it has benefited me in a number of ways. I have more meaningful relationships I talked a little bit about. Healing generational traumas with family members. I've started doing this over the past few months, especially, and it has been, and I'm talking like my mom, my sister, my grandma, and I all did some work together on healing some generational stuff, and it was incredibly impactful. Deeper healing of childhood wounds around relationships. So I have done a lot of healing around things I've carried with me since childhood that I never would have dug into and grown through in the way that I've been able to in the past few years, which has been a huge gift. I have a deeper understanding of myself, which gives me a deeper understanding of others' experiences when they are willing to share them with me. Quality of life that I didn't have before, even though I struggle a lot more at times. It's part of my healing process. Overall, the quality of life is significantly better. I've been forced to practice self-love, compassion, and acceptance in a way I've never known before. And when I do that, it always, this is from the inside out, right? It's a transformation from the inside out, which is my next bullet point that comes up here. That pours, when I fill myself up with love, compassion, and acceptance, it spills out and it touches everyone around me. And so I've been able to find a new way of being as far as helping. Don't get me wrong, I fall back into that pattern of codependency and people pleasing and fawning. And I have really good people in my corner who help me to recognize when I'm doing that. And they do it in a really gentle and supportive way. Successful in the business of helping. So my business is helping people, and our business here has been so successful over the past few years because we have been very authentic and very much about connection and creativity and adaptability. All these really important things that help us to be successful leaders in communities, especially around mental health and wellness. A new lens for seeing myself, others in the world. I feel like I've been given a whole new opportunity to see myself and to understand my purpose that I never was able to do before this. And that kind of goes into a stronger faith and expanded consciousness. I ask myself a lot of questions about why we're doing what we're doing. Who said, why do we do it this way? Who said we have to do it this way? Is there a better way to do this? What is stopping us from doing it a different way? Right? So I ask myself a lot of questions that I never would have understood before. And so I am able to have less limitations around being creative and innovative and creating opportunities and finding opportunities. And then empowerment and being a significant part of my healing and my kids' healing, because if you can remember, part of my trauma was feeling like I was the source of my children's pain and harm. And so to have such an active role in my own healing and their healing helps me to really challenge that unhelpful belief. So traumatic growth, these are all the things I was really fortunate to be able to share this story, a version of this story with the annual Child Abuse Summit in Minnesota in August. I was able to be a part of Greene County Leaders last year. I was able to share this story with the Dallas Children's Advocacy Center when they did their annual Crimes Against Children conference last year, or in August as well. I have started a podcast, started some conversations in the community that I hope to continue soon. I'm a part of the UW Infant Family, or Infant Early Childhood Family Mental Health Program. And I see Kara on here today, Kara Carper. I've been able to partner up with a couple of organizations here, United Way and Kara with Greene County Development Corp, to develop a consultation program for infant early childhood family mental health for caregivers, parents, and providers in early child care settings, to hopefully support families and to help them in a way that our family desperately needed but wasn't able to access. And finally, my vision, the way, my lens and the way I can see the world, I have this vision. I've been able to come up with this vision of things that I've never even really sat and thought about before the past couple of years. And I have a vision for how to create a community that supports everyone within it and creates equity and creates accessibility to services, that we care for one another and that we support one another in sharing stories and making important changes in the systems so that we have accessibility and equity in the services that we provide and the way we care for people. And so this is a mind map I made of my vision. I worked on it forever. So I want to close with, this is one of my favorite books. It's Say Something by Peter Reynolds. And I'm just going to read the very last page because it is my favorite. I come back to this often. And it says, your voice can inspire, heal, and transform. Your voice can change the world. Are you ready to say something? So that always gets me emotional. So here I go again, here I come full circle, just, crying again. I just want to thank you all so much for holding this space for me and for holding on to all these things I put out there. I so hope that you were able to get something out of this. And I really, really appreciate the grace and patience you've given me in the technical end of this. And also just around allowing me a little extra time to share the really important things that I hope you can take with you today. So thank you so much. Thank you to everybody here. And thanks for having me.